I am Dr. Rakshay Shetty. I head Pediatric Emergency and Intensive Care Services at Rainbow Children's Hospital, Marthahalli, Bangalore. So I thought I'll speak briefly about managing pediatric emergencies. We live in tough times. We are going through a COVID pandemic. And oftentimes in COVID pandemic especially, parents are concerned if they should visit an emergency room or not. And oftentimes parents do land up visiting for reasons which are not that serious. We've had patients who were managed at home through video consultations, having emergencies, but are scared to visit hospital. So let me tell a few important clues where visiting an emergency room becomes very important. If you have a child with fever, let's imagine, who is very dull, sleeping half the time, not very interactive, not showing interest in the toys which he normally plays, or a child who's crying inconsolably, is not keeping quiet with routine measures what you normally do, or a child whose behavior has completely changed, if you have noticed any abnormal movements, then this is a time you need to visit an emergency room. Visiting emergency room can sometimes be tough because the rules of emergency room are slightly different compared to what happens in normal outpatient department. You might be made to wait, and it might sound very counterintuitive that I have come for an emergency, why should I wait? Because oftentimes what happens in emergency room is that they go through a process of triage. They find out if the patient needs an urgent attention or not, or if it can wait. And oftentimes in emergency rooms which are very busy, patients who are unwell, who have life-threatening illness, they get a prior attention compared to an illness which might not be life-threatening. So it might not be unusual that you might land up waiting, so you need to be patient. And it's also very important to carry all your old medical records to help the physician to come up with a quick diagnosis. What my suggestion would be is it's always important to find out what is the nearest emergency room you have. Is it a pediatric hospital? If you have a pediatric hospital which is nearby, that's the best, because the ecosystem developed in those emergency rooms are for children compared to going to an adult hospital, because children of various age groups, they require equipments which vary with age. They don't come in one size, unlike an adult hospital where equipments are of same size. So many times, many of these adult hospitals might not be having equipment which is suitable for that child of that age group. However, nonetheless, if you can't find a children's hospital nearby, it's important to go to any nearby emergency hospital you would want to visit. Also, it's very important to find out if this hospital has an intensive care services, because many times if you're urgently unwell and then it's critically and child needs intensive care services, it would be important that the hospital where you go also has intensive care services. When we talk about intensive care services, the children's intensive care units are again quite different compared to adult intensive care units. Many times illness is severe and has complications like having fits. It might need a specialist who is a specialist in fits also to co-manage along with the pediatric intensivist. So a good intensive care facility will not only have equipments like ventilators, like EEG monitoring, state-of-the-art equipments like ECMO, but also specialists like a kidney specialist, like a brain specialist, infectious disease specialist, who also assist in managing these children. So I would suggest that it's important for you, especially if you're a parent, to find out a hospital which has a good pediatric emergency facility, which has all the kind of specialists who can manage all kind of complications, and also has a good intensive care facility.